advocate, you may save someone with a substance use disorder. You may also rescue a 2-year-old who pops a pill into their mouth. You may save someone like me, a 49-year-old who's the most likely demographic to die in Utah because they were prescribed a medication and didn't know how potentially risky it was.
That was Dr. Jennifer Plumb of Utah Naloxone back in June, talking about their incredible milestone of 4,000 lives saved through the use of naloxone. We're talking about 4,000 administered by non-professionals, such as parents, friends, or police officers. That continues our In Focus topic tonight on overdose awareness. Utah Naloxone will host a free virtual training to the public tomorrow at 2 p.m. on the basic use of the rescue kit. We caught up with Dr. Jennifer Plumb earlier today via Zoom on the event and where the state stands on overdoses. Check it out. Dr. Jennifer Plumb with Utah Naloxone, thank you so much for joining us here tonight. I'd like to start the conversation with if you can talk about statistics or numbers in Utah, such as where do overdoses fall along the line of injury deaths, how many Utahns die each week, or where do we fall nationally?
When it comes to opioids and to overdose, we ended up as 4th in the nation in the year 2014. 4th highest, that would be. The only states higher than us were West Virginia, Kentucky, and New Mexico. And this was really, I think, an eye-opener and a shocker to a lot of people because really what we found with that was that we were losing more people to overdoses or poisonings than we were to car accidents and gun incidents together. So it really has been, something that Utah has had to take a look at. Luckily, 2014 was the year that the state really kind of opened its eyes and instituted some measures to hopefully improve this. We got naloxone access laws, and we got Good Samaritan laws, and we started having more educational awareness campaigns, and our numbers started to improve. So we were then more in the 9th in the nation, and then in the 17th. And the most recent data that I'm aware of, we're now 22nd in the nation. So we're still losing far too many people, but thankfully it feels a little bit like we've moved in the right direction.
Going off of that point, in your opinion, how is Utah doing on the legislative level to provide resources or the funding needed to reduce overdoses in Utah? Would you like to see more? Do you think we've come a long way?
I think we've definitely come a long way. There's been a culture shift. There's been a conversation shift that's happened in the state, and that means in our community levels, in our healthcare and public health levels, that means on our lawmaking, legislative, and leadership levels. The resources are not enough, and I don't think that's probably a surprise to many. We need more for treatment. We need more for prevention. We need more to help people when they are truly in this fight for their lives, which medicine and society have not really seen substance use disorder, addiction, the same way they've seen, for example, cancer or diabetes or heart disease. So the resources aren't there enough from a dollar sign standpoint, but I do feel like the culture shift has happened and people are really paying attention and trying to find ways to make it better here. We still have a long ways to go, though.
Can you talk about how this epidemic impacts families and friends of victims? I mean, like you said, overdoses is one of those hidden problems that are sort of out of sight, out of mind for many people.
People's families are devastated. People, my brother struggled for a number of years. He had treatment resources. We worked with him as a family. We were behind him and we still lost him, right? And that was 24 years ago. There's not a day that goes by that we don't think of him, that we don't miss him, that we don't wonder, what if, my kiddo never got to meet their uncle. And there's plenty of families like that, kids that lose their parents, people that lose their spouses. So there is, I think, a significant emotional toll, not to mention fiscal toll, right? You lose people out of your workforce, you lose productivity. There has been a huge burden and a toll on our state because people are struggling.
We have about a minute left in the interview. Let's talk about naloxone itself. Tell me how accessible it is. And I want you to tell me about the virtual training event that's available to the public tomorrow. Tell me about that.
Yes, I'm excited to have the opportunity to get people engaged about naloxone. So naloxone is also called Narcan. And what it does, it's an antidote for an opiate overdose. So if someone overdoses on an opiate around you, that could be pain pills, that could be heroin, that could be fentanyl, any opioid. the way that you reverse it, and this is the way I would reverse it in the ER. I'm an ER doctor at Primary Children's. This is the way I would reverse it in the ER. This is the way ambulance would reverse it, is to give somebody naloxone. And that's basically how you save their life. You get them breathing again. It is a simple little vial of medication. And we have had laws since 2014, that year that really things were so dire here, that allow any person in the state of Utah to have naloxone to be able to reverse an overdose. And we've realized that we've just got to do more to get this in people's hands. Like, you can go into a pharmacy and pick it up, but a lot of folks don't either have the resources or they're not comfortable with going in to get it. And so we've tried to find ways to get this into the homes and the hands and truly broadly across our communities. So in this time of inability of meeting and gathering, we have put together a virtual naloxone training schedule. We've already had 2 of them. We had 387 people join us on one. We had over 100 on the next. And we have one coming up tomorrow. People who want to join us, you just have to log into a Zoom meeting. It's all completely confidential and anonymous. You learn when and how to use a kit, and we will mail you a kit so that you are prepared. It's as simple as that. And we're going to have ongoing trainings coming up I would say we're going to shoot for every 3 weeks, although we also have one next week on October 20th that's in conjunction with Weber State. So learn about naloxone, learn about ways to save lives, talk with people in your family, talk with people in your community about who's struggling and how you can help them, because, you know, nobody can get better if they're dead. And we deserve, I think, as a community, the opportunity to lift people up and to save lives.
Dr. Jennifer Plumb with Utah Naloxone, thank you so much for taking time out of your schedule to talk about this important issue. We appreciate you so much.
Oh, likewise. I'm really grateful for the opportunity. Take care out there, everyone.